right, here we go. The last video we showed you were thoracic stretches. Let's do some hip stretches now. You've seen these before. Now here's the key, and here's the reason why I focus on thoracic and hip, and it's a very important concept. Think about this. If your hips are tight, guess where you're gonna try to get motion? Too much motion either at the lumbar spine or at your knees. That's why we see so many patients that come in with low back pain and knee pain, because their hips are tight. If your thoracic spine is tight, guess where you're gonna try to get motion? Lumbar spine and neck. That's why you get neck and low back problems. So really, if you can open up the thoracic spine and if you can open up your hips, a lot of times your low back pain, knee pain, and neck pain can get a lot better. So the key with the hip is actually internal rotation, and a very simple exercise for hip internal rotation is put your feet a little bit wide apart and drop this knee in like this. Okay? Hold it for about 30 seconds here, and then trying to get a little bit more hip internal rotation. There, you'll find one side that's a little bit tight, but this is a great exercise to loosen up the hips there. Okay? Now, if some of you can't go that far, just have your knees touch like that. Okay? And then go a little bit wider apart and then touch like that. And you're getting some hip internal rotation here. As you get better and better, then you can put it wide apart and then drop one. Okay, so that's hip internal rotation. External rotation is the classic one hand on your knee, one hand on your ankle, and you pull that towards, try to pull the knee toward your opposite shoulder, and you'll feel it right in here. Okay, hold that for 30 seconds. That feels good. And then that feels good right there. So that's external rotation. So you're trying to get movement. If you were to measure internal and external, if you look at my hip, internal, external. I have great external, but look at my internal. It's terrible. Okay, after a few stretches, I should be better off. So external, internal. And if you have limited internal rotation, that can affect your low back. So try those.